Gus, let's have you go down. This is Gus, and this is his last adjustment here. We're releasing him, we're letting him go. Came in with right SI pain. Gus and I were just briefly talking about his trip and journey down. I would tell you 5, if you're going to Crater Lake. Gus, I'm going to have you come down this way for me a little bit. You might want to hit 5, go straight down 5, and then over to Crater Lake if you're trying, if you're talking about timing.
Well, we spent the night in Roseburg, so, and see Crater Lake the next day, and then going out of there down to Grants Pass.
Yeah, well, you're going to be spending some time on the road, but if you're looking to save some time and you've been up that way, okay, we're going to adjust this SI joint again. Yeah, you definitely want to avoid the scenic, the long road down, the scenic area 101 if you're not interested in seeing that. I'm going to have you lay on this side for me. Some of my viewers asked me to turn down the music a little bit, so I'm going to make sure I do that. All right, bend this knee right here. Good. There it is. Other side for me. Good job. So Gus ended up referring his daughter here and a friend, and we got them adjusted. Great people. I hope they felt a little bit better, Gus. Good. On your back for me.
He'll be back today.
Disappointed you're leaving, but I know you got to get home.
Sooner or later.
Big breath. Whoa. Feel a difference there?
Oh, yeah.
What a difference. Good job. You know, sometimes when you have the big meteor guys like me adjusting as a chiropractor, you don't always hear that big crack back there. There we go.
I like the sound of that. Makes me feel good.
Some of my viewers like hearing that big crack too. Let's have you sit up, face that way for me, sir. One of the suggestions to do, break frequently, rest stops, get out, walk around, stretch a little bit. It breaks up that monotony of driving so much hunched over. Change your hand position. Remember the things I taught you about, your neck position. Bend here. Good. Other one. Good. And relax. There you go. We're going to smooth out the rough spots. How about that? Okay, and Gus, what I want you to do, go back on your back, and we're going to do a little bit of traction there in the neck area. The neck's been feeling a little bit better.
Yes.
Lift your head, back down. And I'm going to have you move downward on the table just a little bit. There you go. Good. All right, go ahead, get up. Move around, see if that feels a little bit better than when you walked in, sir.
I always feel better when I leave here.
I'll see you when you come back to watch.